Good morning, everybody, and welcome to our Health to Hold Community Resource Webinar Series. My name is Jenna Sistad, and I'm with the Ocean Monmouth Health Alliance. We host this series once a month, the fourth Wednesday of the month from 10 to 11, and we highlight the great work of our coalition partners. Today, we have Yvette Alvarez of Horizon here talking with us about tobacco prevention and smoking cessation programs. We're excited to hear all about what they have to offer to the community so we can take it back to the respective families that we may work with. So I thank you for joining us today, and a few housekeeping rules before we get started. Please keep yourself muted until the question and answer portion at the end. And also, if you are not comfortable being on camera, we are recording today's session, so you may want to turn the camera off. And without further ado, thank you so much for being with us, Yvette. I'm going to toss it over to you. And in the meantime, if you haven't already, please put your name and your contact information into the chat. Yvette, the floor is yours. Thank you.
Thank you. So good morning, everyone. My name is Yvette Alvarez. I am the Community Health Education Consultant at Horizon. And I'm going to say, if you have joined before, you probably know my colleague Gina, who is out on maternity leave. And so she offered me the opportunity to speak with you all today. So I want to say thank you. To begin with, I wanted to mention a few things that it would be helpful for those of you who are joining who may have Medicaid or know someone who has Medicaid, or even your clients. If you work with individuals who have NJ Family Care, again, we tend to use the two terms to mean the same thing, NJ Family Care, Medicaid. Please remind them that it is very important that they look out for renewal packets in the mail. Many people actually are losing their coverage because they haven't had to renew in the past 3 years, right? So the process started again, and information is being sent to those members. And there are a lot of people who have moved and didn't update their address. So having said that, please let them know that they should be on the lookout for this information. And if they're not sure, to call their HMO or NJ Family Care to find out when they should be renewing. On the other side of that, I also wanted to mention an initiative that started earlier, well, in January of this year, called Cover All Kids. And it is an opportunity for children under the age of 19 who may be eligible to receive Medicaid, regardless of their immigration status. Okay, so I mention this because our mission at Horizon is to make sure that we empower our members to lead their best health. We want our members, as well as the general community, to have every opportunity to live well, to be healthy, to have health insurance, to have access to all those benefits. And whether it is as a member, Horizon member, or just making sure that they're aware of those other resources in the community where they can access health benefits like federally qualified health centers. We want to make sure that you have that information and you're able to pass that on to those individuals that you work with on a daily basis, or just share with anyone else that you might know. All right, so I'm happy to answer any questions around this if you have at the end. I want to make sure that we have enough time, but I also shared my contact information in the chat, so you are more than welcome to email me. Actually, I forgot, I don't think I put my phone number, but at the end, there is a slide that I have. You can take a screenshot and you can either email me or call me, and I'll be happy to answer questions about this if we run out of time at the end. All right, so let me zoom in a little bit on this. So as you may be aware, that we have decided to talk on lung cancer. Our focus is lung cancer since November, right? I think we have one more day left, is lung cancer awareness. We wanted to highlight the importance of lung cancer. And also, I want to mention, I'm going to be talking a little bit about some of the new screening guidelines around lung cancer. So you might see me zoom in on some of the slides just because if I leave it normal, it just looks a little bit too small. But all this information is going to be made available to you. If you'd like, we can share it and distribute it. I'm sorry, did someone say anything? No, okay, maybe it's just me. So one of the things I always like to start off with is to mention that a lot of times we don't think too much about our lungs. I don't want to say that they're overlooked, but we kind of take them for granted, right? We're breathing in and out every day. Thankfully, we're all here. We're doing that. But our lungs is the organ responsible for bringing oxygen into our body, right? So we bring in oxygen into our body when we inhale. And at that time, when we exhale, our body releases carbon dioxide, which is a gas, a waste gas, that is important for our survival, right? And so when we're breathing in, blood travels through our bloodstream, it gets to our cells, to other parts of our body, to our organs. And at the end of the day, this is how we are still here. Fun fact, we breathe on average about 25,000 times a day. And again, I don't think it's something that we think about, kind of like if you think about how many times a day, we must blink. But oftentimes, people will or may develop lung disease, making it difficult for them to breathe. Now, not everybody who develops lung disease will develop lung cancer. It is one of the disorders. Lung cancer is one of the disorders that may develop with people with lung disease. But some of those lung diseases include asthma, COPD, even infections like pneumonia, tuberculosis, influenza. The point of it is that it makes it difficult to breathe. And some of these lung diseases can then lead to respiratory failure, which, as I mentioned, right, we're taking, when we take in a deep breath, we're getting oxygen. And when we exhale, we get rid of those waste gases. So imagine if somebody is unable to take those breaths, right? That means that they're not getting enough oxygen to their organs. They are also not able to allow the body to get rid of those waste products. Okay. So lung disease, or lung cancer, I should say, is the leading cause of death in both men and women. Excuse me. And as we know, right, getting screened, whether it's for lung cancer or any other health issue, it's key to prevention or even having a better outcomes with treatment. And so, as you can see on the screen, that there are two main types of lung cancer, non-small cell cancer, as well as small cell lung cancer. And I wanted to point out that both of these are very different, primarily in the way that they're treated. And the most common cancer is the non-small cell cancer. Excuse me, let me just the small cell lung cancer. And so one of the factors or risk factors that are associated is smoking, which is the cause of most cancers. But I also want to point out, right, as many of us already know, that even non-smokers can develop lung cancer. One of the things I always like to mention, and this is going, some of you may not even know this or be familiar with these people, but many years ago, there was an actor named Christopher Reeve. He played Superman, and he had a tragic accident on a horse that caused him to become paralyzed. I don't know if any of you, are familiar with him, but his wife, Dana Reeve, was a lounge singer, and she never smoked, but unfortunately, about 2 years after Christopher Reeve passed away, Dana Reeve passed away from lung cancer. So kind of ironic, right, that somebody who had never smoked, was fairly in good health, actually ended up developing lung cancer and passing away from it. So as well, like many cancers, you may be aware that it can spread to different parts of the body. Lung cancer is the same way, right? It can potentially spread to other areas, and this is called metastasis. And even when a cancer spreads to other parts of the body, it's important to note that even if it's found, let's say lung cancer, the person developed lung cancer, it spreads to the brain, it is still considered lung cancer, right? Because it is defined based on the location that the cancer was, where the cancer originally started, right? And unfortunately, cancers can spread through the body, through the blood, through the lymphatic system. So that is one of the reasons why screening is so important. So earlier this month, I think it was like November 1st, the American Cancer Society released an update in regards to the cancer screening guidelines. And I don't have it on here for you, but I'm going to, I can provide a link so that you can see it for yourself. But I wanted to point out that one of the differences is under the new guidelines, individuals aged 50 to 80 years of age should be screened, versus in the previous recommendation, it was only those individuals 55 to 74 years of age. Also, persons who, in the current guidelines, it's persons who currently smoke or previously smoked, where in the previous guidelines, it was current smokers who previously smoked and quit within 15 years. Needless to say, there are some other parameters, but the point is that this helps to find lung cancer at an earlier stage. And as I had mentioned, it actually increases the outcomes, better outcomes with treatment. Now, there are some people who shouldn't be screened, and those are conversations you can have with your provider about any individual who, is likely, who's the best candidate for screening, or who, may not be screened. So, which leads us to diagnosing and staging of lung cancer, right? So there are a few different tests that can be done to screen for lung cancer. And so I wanted to point out that testing is needed to get a definitive diagnosis of lung cancer, and to find out the type of lung cancer, where it is, how much, if it's spread. But these are conversations that your healthcare provider will have with you. There are a few different types of testing that can be done or can be used to get a biopsy, which is a biopsy is a getting a small sample of the tissue to be able to know for certain, to get details of the specific cancer. And there are some that are a little bit more invasive. Some of these biopsies may be a little bit more invasive than others, but a bronchoscopy. So I'm going to share just the terms. I'm not going to go into the definitions, but only because this can be helpful for you to at least hear the terms. I always like to try to use the regular terms that you might hear people talk about, but also mention those terms that you might hear your doctor talk about, right? And also just a reminder that these conversations can be very difficult to hear. excuse me. So whether it's you or somebody you may know who is going for a follow-up, a screening, in regards to whether it's lung cancer or any other type of cancer, I always advise people to bring someone with you. Oftentimes, these diagnoses, this information can be overwhelming to hear and to understand. And when your physician or provider is sharing information with you about the next steps, we may not be able to all the information. So it's always helpful to bring someone with you if you can, so that they can kind of be your backup as well as your support. Okay, so some of these tests, as I already mentioned, that used to get a biopsy, it's called a bronchoscopy. Another one, where they go through the mouth. Another one is called mediastinoscopy. I believe they make an incision right in the center here in the sternum. Endobronchial ultrasound, and a fine needle aspiration. But again, remember, these are ways to get a biopsy, and the one that your doctor may recommend is going to be based on your specific health condition. All right. So moving along into talking about staging, it's every cancer is different, which means that for example, somebody who is diagnosed with, let's say, breast cancer stage 2, is not equal to someone who has lung cancer stage 2. Okay, so the staging of cancer is very complex. There are many variables that are involved, but there are different things that are used to determine the staging, meaning how big is this tumor? Is the cancer? Has it? Remember, earlier I mentioned metastasize. Or metastasis is when the cancer may spread to other areas. Okay, that also is taken into consideration when determining the staging. Is it near lymph nodes, which means that it's possible that the cancer has spread. So our lymph nodes are found all over our body. They actually run along the same pathways as our blood vessels. And it is the way that the body gets rid of, also aside from our exhaling and getting rid of waste that way. But our lymphatic system helps to get our body get rid of things that we don't need. And so this is how sometimes cancers can spread, right? Because the blood vessels and the lymphatic system run right next to each other so that they can exchange any waste products for the body to get rid of. And unfortunately, sometimes the cancer can travel through the blood system to other parts of the body. Okay. And so these are all things, again, that your doctor will or would talk to you about as ways to determine what type of treatment and what the next steps might be. So it's important to know that like I said, these are conversations that you should have with your family members, with your provider. But when you're going to the doctor, please try to bring someone with you, because some of this information can be quite overwhelming. And it can be difficult for you to make a decision on how to move forward based on, sometimes we're just not able to absorb it all. Okay. So when an individual is living with lung cancer, just like any other type of chronic condition, be it high blood pressure or diabetes or high cholesterol, it is important that we try to maintain a healthy lifestyle. And a healthy lifestyle can look different for every person. But it should include a few different components, like being active, making sure that you're getting enough physical activity, but also remember that it is important to address our mental health. As I've said, getting a diagnosis, any kind of diagnosis with a chronic illness can be challenging, but obviously getting a diagnosis of any type of cancer is even more so devastating, right? So making sure that we're eating the right foods, that we're managing those foods that we eat, staying hydrated, practice stress relief techniques like meditation and deep breathing, making sure that you're getting enough sleep, managing any other health conditions that you might have. It can be very helpful, as well as lead to better outcomes in the end. Okay, so as I said, the information that I'm sharing with you in the screen, these pages can be shared with you. One of the things that I like about them is that they do also provide additional resources on the bottom, links and phone numbers where you can reach out to get additional information. So whether you are a Horizon member or not, just know that you will have access to this if you'd like. And also you can contact your health insurance provider if you'd like. They can also most likely give you information about the specific health condition that you're inquiring about, whether it be lung cancer or something else. This actually reminds me that, and although I'll touch on it a little bit later, that at Horizon, any individual that is diagnosed with any type of cancer will usually be contacted by a care manager. A care manager is someone who assist you in navigating the health system. They can assist you in navigating your health condition, and as well as additional resources. So they are available for you if you'd like to access them. So, just as a reminder, whether it's lung cancer or any other type of cancer, these are individuals who work for the health insurance company, and you do have access to them. You just have to, in some cases, you may have to request it, but I know at Horizon, any individual diagnosed with a cancer will be contacted to be able to assist in that initial diagnosis and throughout their treatment. So, what are some of the risks for lung cancer? I know many people, I think, will first think about smoking, which is absolutely true. It is the most important risk factor in regards to lung cancer. It causes tobacco smoking is the cause of 9 out of 10 cases of lung cancer in men, and 8 out of 10 cases of lung cancer in women. So, it's not only the act of being the smoker, but just remember that even secondhand smoke can affect an individual, kind of like what I mentioned earlier about Dana Reeves, who was a lounge singer who had been exposed to tobacco smoke and ended up developing lung cancer and passing away from it. So, as many other cancers, unfortunately, and chronic illnesses, in some cases, genetics may play a part in increasing your risk of lung cancer, as well as certain environmental exposures or occupational exposures, I should say. A lot of times people don't realize that in their jobs or out in the environment, people have been exposed to chemicals like asbestos, arsenic, tar, that soot that can actually contribute to increasing your risk of lung cancer. Before I move on, I also wanted to mention, I know many of you know or are familiar with secondhand smoke, but also there is something called third-hand smoke. And that's when the chemicals from tobacco, when it's burned, that they may fall in the environment around us. So many people will, I've seen many people go outside and smoke a cigarette because they don't want to smoke in their home. However, the chemicals from the tobacco will fall on people's clothing. It can go on your skin. It's around you, right? The smoke is around you. It can be in their hair. And so I mentioned this specifically because I want you to think of any people who maybe maybe a parent that has a small child, right? Children often like to climb or be around their parents or mom. If you've been smoking, those chemicals have fallen on your clothing. And so if you go to pick up your child, remember that they are then close to you. They're breathing in the smoke or those chemicals that have fallen on your clothing. And that also can be very harmful for individuals. Okay. So I did want to at least mention that because I think from my experience, many people are not aware about that third-hand smoke. If you're smoking indoors, those chemicals again can fall on the rug, on the floor. I don't know if any of you have ever walked into a home, even a vacant apartment or home where smokers once lived, and you can smell the odor of tobacco. It is not something that you don't get rid of those chemicals just by airing out the room. They stay there, right? And it's very difficult to get that smell out of the home. Okay. I hope that some of this information you find it new or helpful. Hopefully some of you might realize that that you weren't aware how these chemicals could affect young people. And most importantly, children, many young children are developing respiratory issues such as asthma, not only because of smoking, but also because of environment, as I mentioned, where there is a lot of pollution in the air pollution. They may live near a factory or areas where there's a lot of transportation, and that smoke from vehicles, the exhaust is affecting how they're breathing. Okay. I do want to point out that, for example, in pregnant women, smoking can cause bleeding problems, miscarriages, stillbirth, or birth defects. Okay. And as many of you may know, that smoking affects the small blood vessels in our body, and becomes even more dangerous for individuals who have chronic illnesses such as diabetes, as well as high blood pressure. Okay, so we want to try to do things to prevent or reduce our risk for any type of cancer or illness. And oftentimes it's the these other little factors, our lifestyles, that are contributing to increasing our risk for illness. And so individuals who may develop lung cancer typically will experience or may experience difficulty breathing, blood in their sputum, or when they cough, right? And if anything comes up, like phlegm, they may experience blood in that whatever they cough up. So as well as this that persistent cough, right? You may know someone who has been a smoker for a long time, and they may have this persistent cough. Now, again, I don't want to say that if somebody has this cough, they have lung cancer. No, but it is important to be aware of these symptoms. Oftentimes, people kind of write it off, they minimize it. They will, it happens over time that they really are, how could I put it? You almost don't recognize that, the person doesn't recognize that this is a problem. So it's important, right? To remember, I said early screening, early detection helps for better outcomes. So making sure that individuals are going to see their healthcare provider on a regular basis, making sure that they are taking some of these symptoms serious, right? One of the other things that I wanted to mention was also that it isn't only smoking that can cause lung disease, but also vaping. It is a big risk factor for lung cancer development. Many young people, unfortunately, have taken up smoking, vaping, and think that it is a safer way or safer than cigarettes. Unfortunately, that there's still some research that has to be done. And so it's some of the information that is available. It is not definitive, but we all know that putting anything into our lungs other than air can be harmful and can have negative side effects. Unfortunately, when an individual vapes, sometimes they're not necessarily. So let me step back a moment. Vaping or electronic cigarettes was first developed as a tool, or supposed to be marketed as a tool to quit smoking cigarettes. But we all have seen over the years that it has gone in a different direction. Some of these companies have said that they are removing certain flavors from their product line as a way to reduce it being attractive to young people. But unfortunately, we know nicotine is very addictive, and it can damage the DNA of cells, right? So it can, our cells are constantly, there are, how can I put this? Our organs are constantly are creating new cells and getting rid of old cells. So if our DNA and our cells are damaged, right, when it creates new cells, those new cells would be damaged. And so just like it happens in skin cancer after repeated exposure to the sun and sunburns, the sun can damage the DNA in our cells. So when the cells reproduce in our skin, it can contribute to abnormal cell growth, which can cause maybe a cause for skin cancer. And the same thing can happen in our lungs. So I want to encourage you to share information to any young people that you might know who may have picked up vaping as an alternative form. As we know that a lot of the flavors that were developed by the vaping companies, like tropical fruit, you think of a drink when you think of tropical fruit, or a specific fruit, and you think, well, that can't be harmful. Well, to consume a tropical fruit like a mango is not harmful, but those flavors were not meant to be inhaled into our lungs. So it is important to kind of put that into perspective and understand that just because it is safe to consume a flavor doesn't mean that it is safe to inhale that into our lungs. As I said, the only safe thing to inhale into our lungs is oxygen. So again, cigarettes, as well as vaping that contains nicotine has thousands of chemicals, and many people who have experienced vaping are consuming or inhaling products or chemicals other than what it was intended. So there are studies that show that THC has been found, tar has been found in these products that people are using to vape, when originally it was only supposed to be used for nicotine and to reduce the amount of the desire, I guess, of using cigarettes. Okay. So that brings me to, what can you do to address or control tobacco use, right? Specifically smoking. But again, there are programs that address smoking, whether it's tobacco cigarettes or vaping. At Horizon, as I mentioned, there are care managers that can connect you with a program to take care of or address the steps that you need to take to become smoke-free. By quitting, that you can actually improve your lung function and circulation, reduce your chance of developing certain cancers and heart disease. So remember that there are resources available. If you are a Horizon member, you can contact member services. It's the phone number on the back of your card. In New Jersey and at Horizon, there's a New Jersey Quit line that you can reach out to. There are many different forms of quit services that are available. It could, whether it's on the phone, you can meet in person. There are support groups that you can connect with, as well as even texting. Many young people prefer to utilize the texting feature instead of speaking to someone. So when you are ready, and even if you're not sure, you want to get more information to educate yourself, as well as maybe try to educate those around you, try to access that information, get the information that you need. What are the steps that you need to take? So, when you decide that you want to quit smoking, make a plan. I'm sure that it's very easy for any of us to list reasons why someone or maybe yourself may want to quit. I think it's also key to remember that there are certain things in life that can cause us to, or it could be a trigger for people to pick up cigarettes, smoking, or vaping. The same way people may be led to overeating, right? Things like stress, boredom, frustration, anger, those are all triggers that many of us could probably identify, right? But we have to find more positive outlets. And so again, at Horizon, we can assist you in that process. And remember that in New Jersey, that there are a number of resources that are available. The NJ Quit line, there's the Quit Net, NJ Quit Centers. I know that there's also another program called Moms Quit Connect. So the resources are there, they're available. And we encourage you to take advantage of it. At least arm yourself with the information that you can share either with someone you care about, for yourself, or even your clients. So with that said, thank you for your time. And my contact information is on the screen. Please feel free to take a screenshot of it. You can connect with me either via email or telephone. And on that note, I'm going to hand it over back to Jenna.
Wonderful. Thank you so much, Yvette. This is great. I personally learned a lot. I thought it was super interesting when you were talking about the two different types of lung cancer and then also the common places for it to spread, like to your brain or to the other part of your lung. Personally, I didn't realize that. So very good information. Thank you.
Yeah. You're welcome. And you know what? Actually, I wanted to mention something. Now, this is not evidence-based medicine, but I did want to share that one of the ways in which what we can do to stay healthy and improve our lung health is to no, this is evident. I mean, this is true, right? We're doing exercise and eating well, but using an air purifier in your home.
Mm.
Um, and I will say that my mom actually is a asthma sufferer. She was a smoker. Actually, everyone in my family was a smoker except for me, and it was terrible. They no longer smoke. However, it's been I would say maybe 30 years ago that they quit smoking. Anyhow, just this past year, I had bought an air purifier for myself, um, and my mom was having, I forgot what it was. I don't know. She had a upper respiratory infection, but the short of the long of it is, I gave her my ear purifier, and since then, it has. She says it has improved her health. She is not having to take certain medications as often. I would highly recommend that if somebody is challenged with some type of lung disorder, that that might be an option for them as a way to improve their lung health on a day-to-day basis. Yeah.
No, that's a very good point. And truthfully, I've seen a world of a difference too. We live in a Cape house and there's not a AC or a heating unit up on the second floor where our boys sleep. And so we
Mhm.
did put some air purifiers up there and I could see that they're not as nasally and boogie all the time. So
Mhm.
definitely helpful.
Yeah.
Thank you for that. I just wanted to address a couple of comments that came through as you were presenting. Um, we have one participant saying, very informative, and thank you, Anna, for sharing some of the updated guidelines from ACS's perspective. And then Karen, who had to hop off, but did share excellent information and presentation. Thank you kindly. So we have interest from the participants who are joining us here today. I
Mhm.
want to take a moment to open up the floor to anybody who has anything to add to the presentation or anybody who has a question that they'd like to ask for Yvette of anything that she presented about. Or maybe something you didn't hear today that you were hoping to hear.
Yeah. One of the things, I can't remember, there was one chart that listed the differences between the old guidelines, the lung cancer screening guidelines, and the new ones. And it would have probably been a helpful visual, so I apologize that I didn't include it. But I think the point of it is that more people will kind of fall into the new, more people will be screened in the new guidelines. Um, and so it is important that people are aware so that they can ask their providers if they're a candidate to be screened.
Yeah, no, it's it's a good point because many people, like you said, like one of the first sentences in your presentation, like sometimes we take our lungs for granted. We don't even realize with the second hand and the third hand how much we can be affected. So, okay. Does anybody have any questions or anything else to add? No. Okay. So, thank you, Yvette,
Thank
for
you.
the information and talking to us about how Horizon can help lead people to quit services. I'm going to give some updates now on behalf of the coalition before we wrap things up for today's session. So, in the chat box, I'm putting a couple of things that are up and coming for us as our region's Cancer and Chronic Disease Prevention Coalition. Tomorrow we have an Understanding Medicaid presentation happening via Zoom with our friends at AmeriGroup. They're going to be talking to us about how people can enroll. Yvette, you mentioned something earlier about Cover All Kids, and they'll be talking about who's eligible to apply how people can get linked with the service, and kind of debunking any myths that people may have or stigmas around the enrollment process. So that's tomorrow at 10 a.m. and I put the registration link here for us. And then the next thing that I mentioned there is just the continuation of this particular series, Our Health to Hold. As I mentioned in the beginning, we offer this once a month with our coalition partners as our presenters to highlight the health awareness months. We will be skipping December for the holidays, but we will resume the series in January. So the next series session will be on January 24th at 10 a.m. and it will be with Planned Parenthood to help us recognize National Cervical Cancer Awareness Month. So that information is in the chat. So we hope you can join us for some of our upcoming events. We're always looking for more coalition partners. So if you think of anybody who would be appropriate to kind of join us for these education sessions, or a good partner that wants to be involved in all that the coalition does, please let me know. And also, if you can, I will be sending out a survey after today's session to just kind of give us some feedback on how the series went for the year. And please feel free to be as honest as you would like. We are always looking for ways to improve. So that's not just on today's session. It will be on all of the sessions for the whole series. So that as we continue to make adjustments moving forward, we can, consider your input. So those are all the updates that I have. Again, thank you, Yvette, for helping us raise awareness about Lung Cancer Month, and thank you to everybody else for joining. So thank you, and have a wonderful holiday season, everybody.
You too.
Take care.